Hi, I'm Dr. Kathy Judkins, and I'll be discussing how to choose a child psychologist. If you are considering seeking help, or if it has been recommended that you seek help for your child, knowing where to find a competent psychologist can be a daunting task. How does the process work? How do you know if someone is competent? What do all the titles mean, such as therapist, psychotherapist, counselors, and psychologists? We hope to answer these questions for you and give you some things to think about as you begin your search for a professional to help your child. It might be helpful for you to begin your search by understanding the different degrees and titles. A psychologist can only call themselves a psychologist if they are licensed by their state. A psychologist typically obtains either a PhD or a PsyD. A psychologist with a PhD has attended a 5-year graduate program after college that is specific to clinical, educational, developmental, or counseling psychology. A clinical psychologist earns their degree from a clinical psychology program. A clinical child psychologist has specific training with children. In addition to courses and research, students see patients through their training while also taking classes. Then they complete a 1-year internship dedicated specifically to treating patients while under supervision of a licensed professional. Following internship, many states also require a 1 or 2-year postdoctoral fellowship to complete state licensure. A psychologist with a PsyD has also attended a 5-year program, but there is typically less of an emphasis on research compared to PhD programs, but this is not always the case. Finally, master's level clinicians have attended a 2-year graduate program that includes coursework and seeing patients. You also may have heard of an LPC, which stands for Licensed Professional Counselor. This is a title that indicates that a mental health professional has obtained a degree in counseling and is licensed to practice independently in their state. The majority of LPCs typically have a master's degree. A social worker has a bachelor's or a master's degree. In most states, social workers are able to be licensed as clinical social workers. If you see the letters LCSW or MSW behind a therapist's name, this is typically the degree they possess. Your child may eventually need to see a psychiatrist in addition to a therapist. A psychiatrist is a medical doctor who is able to prescribe medication, while psychologists cannot prescribe medication. Psychologists also usually meet with patients more frequently, particularly in the early stages of treatment. Inquire when you call as to the specific credentials the therapist has so you can understand their background and determine if that person is an appropriate fit for your child and family. Since I am a child psychologist, I will review the specific characteristics that are important in your search for someone in my profession. Number 1, you want to make sure that the child psychologist has expertise with your child's issues. When you first speak to the psychologist, they will be asking you questions to determine if they can treat your child, but you should also ask them questions to determine if they are the right choice. For instance, ask if they treat patients who have similar problems as your child. Number 2, find out if they are licensed in your state. States have regulating boards that grant licenses to individuals who meet minimum standards in education and clinical practice. Therapists are required to have this license visible in their office. Number 3, ask about the therapist's educational background. Was their education specific to children and adolescents? If not, when did the therapist receive her specific training with children and adolescents? Treating children is different from treating adults. The next thing you want to determine is what percentage of a psychologist's practice is devoted to children and adolescents. Generally speaking, the higher percentage of children and adolescents in that practice, the better the indicator that that person has more of an expertise in child psychology. Finally, the main thing you want to achieve is a match between you and your therapist. You want to feel comfortable with the person since you will be discussing personal family issues. If you don't feel comfortable with the therapist, the therapy may not be as productive for you or your child. You may not know how comfortable you are until you have had a handful of sessions with the therapist. Also, be sure to ask questions about therapy goals and do not hesitate to ask the psychologist if you feel that your child is not making progress as you had expected. Once you have found a psychologist that you feel has the right qualifications to see your child, ask about the process of assessment and treatment. Does the therapist meet with parents initially and only as needed thereafter? Are parents kept informed of their child's progress throughout therapy? What information from the child's session does the therapist share with parents? Will the psychologist give you ideas on how to help them at home? So the next question is, how do you find a child psychologist? Avoid just opening the phone book. Get specific referrals from people you know if possible. Ask your pediatrician if they have someone that they know and trust, or ask friends or family members. If your place of employment has an employee assistance program, they might have referrals available to their employees. You can also call your insurance company and they can provide you with a list of therapists and may even have a profile of their therapists so they can inform you of the therapist specialties. Finally, you can consult the American Psychological Association to find names of psychologists in your area. However, the website does not distinguish between child and adult psychologists. Thanks for watching, and we hope these suggestions are useful as you search for a child psychologist. You may also want to watch our video, Paying for Psychological Services, to understand the process of using insurance or paying privately for therapy.